Okay, this is for my head to toe assessment, my video. Here's my card, front and back. I will place it over here, give you a panoramic of the room. And my daughter is going to film this for us. All right, so I would walk into the room, close the door for privacy, introduce myself. Hi, I'm student nurse Teresa Wagner. I'm here to do an assessment on you today. Is that okay?
Yeah.
All right, now hand sanitize. Can you tell me your name and date of birth, please?
Yeah. Ben Wagner, 4/7/1975,
All right, and what month is it?
December.
Okay, and do you know where you are?
Yeah, I'm in my bedroom at my house in Mount Juliet, Tennessee.
All right, so patient is alert and oriented ×3. Patient has good mood, good affect, is able to hear, is able to speak, is able to walk. He walked into the room with no problems. He has good posture, good body stature, is well hygienated, and is well nourished, and his skin tone is normal for ethnicity. So that was just your general assessment. All right, so I'm gonna palpate I'm gonna feel around in your head. Is that okay?
Yeah.
All right, so feel around on the scalp. Scalp is dry, don't notice any dandruff. Hair is smooth, and head shape is normal, cephalic. I didn't see any lesions or palpate any bumps or anything of that nature. All right, so clench your teeth, raise your eyebrows, clench your eyes, puff out your cheeks like this, stick out your tongue, and move it side to side. All right, cranial nerves 7 and 12 are intact. All right, now I'm going to take a look at your eyes. I'm going to use my pen light for this, so if you'll just follow my pen light. All right, cranial nerves 3, 4, and 6 are intact. All right, now I'm going to shine a light in your eye, and I'm just checking your pupils. So pupils are equal, round, and just follow the pen. And reactive, they both accommodate. And now I'm gonna flip down here, and I'm just gonna look at your conjunctiva. It is pink and moist. Sclera is white. Irises and corneas are nice and round with no lesions or any abnormalities. All right, I'm gonna take a look at your ears. They are symmetric to your face. They're even, they're intact. Take a look inside. All right, don't notice any lesions or earwax. No lesions or earwax. Bilaterally, tell me if there's any tenderness. Any tenderness in your ears? All right, how about here?
No.
And back here?
Nope.
All right, now open your mouth. And we're going to draw side to side. That's good, thank you. All right, now I'm going to take a look at your nose. Its skin tone is normal. It's straight, aligned with the face. There's no lesions or noticeable tumors or nodules. I'm going to take a look inside. Nasal mucosa is pink and moist, no deviated septum. Hold one side of your nose and blow, and do the other side. And nose is patent. All right, now I'm going to take a look at your mouth. So lips are intact, no cracks. Teeth are present. Gums are pink and moist. The buccals are nice and moist. We have the tongue looks good. Now if you can stick your tongue out and say ah. Uvula and soft palate are movable when the patient says ah. All right, now I'm going to palpate your neck here. Just tell me if there's any tenderness.
No.
All right, no tenderness or no palpable lymph nodes. Neck is aligned, is straight. There's no noticeable lesions. Skin tone is also normal for ethnicity. And anyway, it looks normal. All right, so look that way with your whole head. I just wanted to test your range of motion. And now look the other way. Now look up and look down. All right, full range of motion. Now push against my hand. All right, this side, to the front, and to the back. All right, and good muscle strength. It's equal bilaterally. I'm going to do that same thing. Your shoulders shrug up. All right, yep. And muscle tone is shoulders are even, and muscle tone is intact for his shoulders. All right, I'm gonna go ahead and I'm gonna listen to your lungs. Can you remove your shirt? Do you mind? All right, so normal, I said normal, sorry about that. It's the patient's skin tone is normal for ethnicity, and I don't notice any lesions or masses protruding. AP diameter is a 1:2 ratio. All right, and every time you feel my stethoscope, if you would just take a deep breath in and out, okay? All right, normal breath sounds anteriorly. If you'll just turn your body this way, I'm going to listen to the back, but that way she can see it with the camera. And same thing, when you feel my stethoscope, if you would just take a deep breath in and out. All right. All breath, there's no crackles, there's just normal breath sounds throughout anteriorly and posteriorly. Nothing to report. I'm gonna listen to your heart now, if you'll just turn back where we were. And I was gonna tell you at the very end, don't turn the camera off because I get to look at the card, so just wait. All right, so we're gonna start here with aortic. Pulmonic, Erb's point, tricuspid, mitral, all right, S1 and S2 are present, no murmurs are heard. Rhythm and rate is normal bilaterally. All right, now we're gonna take a look at your abdomen, so if you would lay down for me. All right, so first you would take a look at the abdomen. Again, the skin tone is normal for ethnicity. I don't notice any masses or lesions, nothing protruding from the belly. Umbilicus is present and everything seems to be symmetrical, nothing off kilter. All right, so first I'm going to listen. Okay, normal active vowel sounds in all 4 quadrants. I am gonna push down in your belly, just let me know if there's any tenderness. Any tenderness? All right, I'm gonna go a little deeper. Okay, no palpable masses and no tenderness reported. Okay, you can sit up. All right, now we're gonna do a neuro exam. So if you would take your finger and hit my finger and just keep doing it, and let's see how fast you can go.
To my nose?
To your nose. All right, now try the other hand. All right, good job. And now place your hands on your knees and do rapid back and forth as fast as you can. All right, good job. Now take the heel of your foot and run it down the front of your shin on both legs. So do one and then the other. All right, so cerebellum is intact. Patient is able to perform the task. All right, now I'm going to do a light touch sensation. So you're going to close your eyes, and when you feel me touch, you just say yes, okay? Separate your hands for me. There you go.
Mm-hmm. 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 Yep. 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 Yep.
All right, light touch sensation is intact. All right, if you would stand up for me, please, sir, and put your feet together and put your hands to your side. All right, now close your eyes. Okay, Romberg's test is negative. All right, and if you would turn this way and bend over, I'm just gonna check your spine, make sure it's straight. All right, spine is straight and patient has range of motion in their spine. All right, now if you would just walk normally to there, and now come back on your toes. You're walking on your toes, and then walk on your heels. All right, thank you. If you'll have a seat right there. So musculoskeletal system is intact. That was the end of that, and I'm going to check to see, make sure that I got everything. Okay, so I missed a few things. So if you would just raise this arm, I'm going to check your axillary nodes. Any tenderness reported there?
Mm-hmm.
How about on this side?
No.
All right, no palpable lymph nodes there. I also forgot to check your carotid pulse, so I'm just going to check that. Okay, carotid pulse is a +2 on both sides bilaterally. All right, say ah again. All right, and tonsils are a +1. Let me check one more time, or I might only get one check. And I'm going to palpate your frontal sinuses. Just let me know if there's any pain or tenderness here.
No.
Okay, how about here?
No.
All right, so patient has no tenderness reported in maxillary and frontal sinuses. All right, thank you for being my patient today. You can stop the recording.